It's normal for people like me to start a speech at a conference like this with that bland phrase, "It's good to be here." But given there's been a reshuffle since I expected to speak at this conference, I can add new feeling and meaning to that bland phrase. It's really good to be here. It really is great. And actually, I'm just working it out a little. Is that my exit call already? Oh my God, it's not going well.
Let's go to the lunch queue.
Oh dear. It is in fact my third time. 2009, 2011, this year 2013. I was thinking how to explain what that feels like to have done this 3 times. And I thought I'd use an analogy that would make some kind of sense to you. As a 3-time parent, I thought I could describe it through parenting and all that means. So the first time I came, I was nervous. I was loaded down with briefing and equipment and I had a big entourage of helpers and it was all very overwhelming and tense. The second time, I was tense, but I knew what to expect. And the third time, well, you know what a third-time parent is like, don't you? You know, it's all relaxed and you're not as scary as I thought you were. But what I want to talk to you about today is there are obviously difficult times in the NHS. That goes without saying, I think. But the reason why I'm here is not just to talk to you about maternity and midwifery, which I will touch on, but I wanted to put things in the bigger picture. And what I wanted to do was to offer some hope that there is, for those who want one, an alternative to the current path that the NHS is on. In my view, it's a path to privatisation and to fragmentation. And I want to explain Labour's emerging alternative to that direction, reflecting on our time in government, but also offering a different future for our wonderful National Health Service. The emerging policy is whole person care. Whole person care. I'll come back and explain more what that means. But I want to begin by explaining it through something that's probably familiar to you from your training, and that's the 1948 World Health Organization definition of health, which, if you go on their website, still stands today, which I think says something about it. And the definition is this: health is, quote, a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Complete physical, mental, and social well-being. Really important words. The same year that the World Health Organization was setting out that definition, of course the NHS came into being. The NHS was born. For all that it was a wonderful step forward on pre-NHS healthcare in this country, I would argue that it has never been set up to deliver that compelling World Health Organization vision. And why is that? It's because of the exclusion of the social from the NHS, the social part of care, if you like, the human side of care. And the exclusion of the social from the system has meant that we have an NHS, for all of its strengths, it's never been able to see the whole person. It can see part of the person, some of their needs, but not all of one person's needs. We've had a system, haven't we, in this country for 65 years that says to people, particularly older people, that the council deals with that bit of you over there, and the NHS does this bit over here. And in this century, the century of the ageing society, I don't believe that that approach is sustainable anymore. And this system, which excludes the social, has built a medicalised model of care. It's not a system that sees the home as its natural territory. You know, it's a system that waits for people to fail where they live and then pick up the pieces in an institution. It doesn't have prevention in its DNA. And my vision for a 21st century NHS is one service that can see the whole person. mental and the social. Social care as part of the National Health Service. I believe if we had such a system, a National Health and Care Service, if you like, we could really change the way we think about the way we deliver care. We could move away from a target-driven system, or a system that only sees part of the person, to a system that sees the whole person. And if you think about older people in the later stages of life, I think we then could make the big changes that we need to make care what it should be, where we start in the home, with a team that doesn't have that council or NHS divide, where the occupational therapists and the physios work with the district nurses and the GPs and the rest of the team. One team around the whole person, where the family has one point of contact for the coordination of all of mum or dad's needs. Imagine what a step forward that would be for families that currently face the frustration of telling the same story to every person, professional, who comes through the door. And in this system, you could build an incentive to keep people at home. I think as Victor was saying before, home is the default setting for where care should be, rather than a default position of the hospital being where people end up. It's a different way of thinking about care. And I'm certain of one thing, that we aren't going to get the care we want for your parents, for my parents, for anybody's parents, from the current system we've got, and particularly the system we've got for looking after older people. It is today a malnourished, minimum wage, 0 hours system, dishing out care in 15-minute slots, where there isn't enough time to make a cup of tea, let alone have a proper conversation. It's a system that says to the young people who come to work in social care, that looking after someone else's parents is the lowest calling, the lowest of the low, rather than what it should be, the highest calling that a young person can answer. And that is how I want to reshape the system. Whole person care, a national health and care service for later life. And I think we can begin to understand the possibilities that emerge. But this principle is as applicable, in my view, to the start of life as it is to the end of life. And I want to explain a bit more today how this idea of a single service for the whole person could reshape fundamentally antenatal care, labour, postnatal care, where we see the person rather than the patient, where we have a social rather than a medical model of supporting people, where we give new mums and young families a much broader range of support. I think if I was understanding Victor correctly, he was saying that often what prevents people having a good experience of childbirth or parenthood is not a medical or a physical problem. It's often the other factors in their life, their home, their relationship, their work, all range of things, their benefits or lack of them. And if we could think about supporting people to kind of get solutions that work for them, truly personalised care, then I think we'd be making some real progress. So that's where our policy thinking is going, moving towards the idea of single budget commissioning at a local level by the Health and Wellbeing Board, led by the local authority, but commissioning from the NHS as the preferred provider, NHS preferred provider at the heart of this model. And the NHS fulfilling that expanded role, physical, mental and social, an NHS for the whole person. That's something I think that might mean something to you. And in that system, when it is a single budget, where you don't have the meaningless arguments anymore of council saying, well, we're not going to invest in that preventative services, the NHS gets the benefit, and the NHS saying the same. That would go, wouldn't it? You'd have a system that would truly prioritise prevention. We know, don't we, the difference that investment in those very early weeks, months and years of life can make. We all know about the change we can make to a young life if they have that intensive support at that early age. So my question is, why on earth aren't we doing it? Why aren't we piling in the support, particularly for those families and those youngsters that need it. We've all been at conferences where people talk about the importance of early intervention, but it doesn't happen, does it? Because the public sector is all in its silos and nobody takes the lead or has the responsibility. We need a system with prevention truly at its heart. And what this comes to really is a vision based on the founding values of the NHS: integration, collaboration. And let me be absolutely clear with you about this today. The vision I'm outlining to you, Labour's emerging policy, is a vision based on the rejection of the market in the National Health Service and in health and care. Choice is a good thing, but it's not the same as competition. It's not a cuddlier word for competition. I believe we can offer people more advanced notions of choice and control in an integrated system than we can in a fragmented, competitive, market-based system. I'm not neutral about provision, about who provides services. I want to be honest with you about that as well. I never have been. I believe in the public NHS and what it stands for, its values, a system based on people before profits. I think politicians on all sides have been too cavalier and casual with that, and have even sent a message out at times of private good, public bad. Well, that's not me. I believe in those values that Danny Boyle celebrated at the opening ceremony of the Olympic Games, the values of the NHS, a system where, when anybody walks through the door, it's who they are that matters, not what they earn. It's their need that matters, not their background, not their means. I feel if we carry on down a path where we're increasingly allowing the market into the NHS, we will in the end devour what is so, we will let that market devour what is so precious about it. For me, the logical consequence of compulsory tendering in the NHS, or any qualified provider, where every service has to be tendered, is fragmentation of care. It's the loss of the continuity of care that is so important in your profession. I will acknowledge that we let the market in too far when we were in government. We opened the door, you might say. But I can tell you something else. This government has taken the door off its hinges and opened the floodgates as well. 2 years ago, when I came to this conference, I made a pledge for the first time, and I want to repeat it to you today. The next Labour government will repeal the Health and Social Care Act 2012 and restore the right values back to the heart of the NHS. For me, those values are cooperation, compassion, care over competition, people before profits. Back then, if you remember, November 2011, there was a clamour, there was a kind of crescendo of noise building, urging the government to honour that commitment of no top-down reorganisation. I think people could see the dangers of reorganising the system at a time of financial stress and everything that might mean. Turning the system upside down when there are major challenges affecting the sustainability of services. But they went ahead. And what I would argue is what happened then was at a stroke, focus shifted from the front line to the back office, with the managerial merry-go-round and all that entailed. £3 billion roughly siphoned out as frontline care to pay for this back office reorganisation. Thousands of six-figure payoffs for people who've been re-employed in the new organisations. How can that be justified? I don't think it can. And 2 years on, we now have a system that has more very senior managers than it had before, and of course, fewer nurses. The system has been dragged down by the effects of reorganisation, in my view, and we're seeing that now through the pressure on A&E. A&E is the barometer of the system. Any problems or blockages in the health and care system show up through pressure on A&E. And there's a combination of reasons now why A&E is struggling. We've had a loss of focus on the front line, as I say. We've had a distraction from the recruitment challenge that should have been a primary focus. Distraction from training. And that, in my view, has left the NHS in a fragile